epidemiologist Dr Devra Davis. She's the founder and president of the think tank Environmental Health Trust. She's also advised the World Health Organization and the United Nations and US President Bill Clinton. Thank you very much for your time there, Devra. Now, when Omicron first appeared in South Africa, the Biden administration was fairly slow to put in place the more serious measures eventually instated just a week before Christmas. What lessons do you think the Biden administration has learned in all of this?
Well, I think all over the world we've learned the lesson that we've paid a big price for Christmas celebrations, because in January in the United States and in many countries we saw the highest number of cases of COVID that have ever been recorded. So that's one of the problems that we've had, is the trade-off between the economy, culturally important events like Christmas, and the recognition that this virus requires us to take actions that we've never taken before.
So what would you say that Omicron has taught us and the government, how best to approach the Omicrons of the future?
Well, I think everyone is understanding we need a new normal. We need to understand that we're going to have to live with the virus, that it is becoming endemic, that we can't eradicate it like we did smallpox for a variety of reasons, not least of which is because of its fast mutation here. The good news, if there is that Omicron appears to be much less virulent in those who are vaccinated. Unfortunately, we are seeing children hospitalized who are not vaccinated with much more serious cases in some states around the country now.
And is there research to show that Omicron follows a similar pattern to viruses of the past, like the flu, where COVID gets more transmissible but also less severe and then eventually kind of fades out? Is that something that we might be looking at?
Well, that's exactly what we're hoping for, but I think what this virus has laid bare is that the failure of the United States to have a national health system and the failure of the United States to have a national system for tallying these cases has really been a problem. We do not have valid, accurate data on the number of cases of COVID. For example, the increase in hospitalizations, how many of the patients that are in hospital are in hospital for other reasons but happen to have COVID, versus how many people are in the hospital because COVID really led them to the hospital with serious complications for respiratory problems, for example. And those are the kinds of things that will only be solved if we have a better national surveillance system, as Zeke Emanuel and colleagues have talked about in the JAMA, the Journal of the American Medical Association, this week.
So along with those very important sort of infrastructure ideas and policies, what will it take, do you think, to find the sweet spot here where societies can begin to function again normally?
Well, that's a good question. I'm hoping what it will take is more and more people understanding that we are all in this together, and that many of our sports figures and people who are influencers will continue to work to promote the understanding that masking is one of the most important things to do, that cloth masks are no longer a good idea. They were only an interim approach when we couldn't get access to hospital-grade N95 or KN95 masks, which have materials which themselves are antiviral. So we need to understand you need to wear hospital-type masks now, and that masking does actually prevent the spread of the disease when masks are worn properly, which is not to touch this area of the mask and to put them on and off by the ear pieces so that you don't contaminate yourself in the process as well. Masking can be very valuable, and we have to also understand the need to test people before they return. If they're isolated for 5 days or 10 days, and 5 days is now the CDC recommendation, they should not resume their normal activities until they've tested negatively, because we know the transmission is highest in the early stages of the virus. Ironically, unfortunately, in the 1 or 2 days before a person becomes sick, they are in a high state of transmission for the Omicron variant. And for that reason, we have to start to think of everyone that we encounter who is not part of our bubble as potentially carrying Omicron, and we have to be very careful about being around other people in indoor spaces. As the CDC and many others have pointed out, it is the indoor environment where there's not good circulation that is most problematic.